Fabulous, thank you. So I'm the Business Relationship Manager for NDSP, one of the Business Relationship Managers. So I'll be hosting this session along my colleagues today from our WA office. We would like to begin today's info session with our acknowledgement to country. NDSP acknowledges the traditional custodians of country throughout Australia and recognise their continuing connection to land, waters and culture. We pay our respects to elders past, present and future, and anyone joining us today of Aboriginal or Torres Strait Islander origin. We acknowledge the Whadjuk people of the Noongar Nation as the traditional custodians of the country from where we are presenting in Perth today. On your screen is a gorgeous piece of artwork, and this is done by artist Elizabeth Close, who is in South Australia, and the artwork has two names, Feels Like Home and Sand Dunes. Today's info session is being recorded to be shared via the NDSP YouTube channel with people who weren't able to join us today. Any questions shared will be recorded on here as well. We'll also share this PowerPoint with all attendees after the session via email. So the slides include links to helpful guidance and resources. So welcome again, everyone, and thanks for dialing into our first session of 2022. Happy to have you with us. Agenda for today, we're going to be looking at just introducing you to who's on the team presenting, where to look for the guidance, the questions that you had for us will be addressed, and open up to questions from the floor, and then there'll also be some feedback at the end. If you're a first-time attendee to one of our sessions, we aim to hold these online every quarter. The sessions help us bring us together as a group to share helpful info and keep our education up on the various topics across our sector, and ultimately to help people get the best out of their NDIS plan. So we're pleased you've been able to take the time out of your busy schedules to join us today on this information session of COVID-related purchases. As you know, as WA ramps up with increasing COVID cases daily now, where we thought it would be really timely to get together and discuss this topic with you. So thank you for also providing those questions when you registered. There were some common themes amongst the group, which we'll talk through together about today. So as I mentioned, Roy Marder, one of our senior WA client services officers, is based in our Mirrabooka office and will be answering the questions today. You may have already had the pleasure of dealing with her and experienced her expertise when you've made contact with the office for assistance. Roy Marder's been working in the industry for many years, and she's very passionate about helping others. She's also been involved with Cat and Dog Rescue for almost 10 years. And a bit about her, she loves the ocean and is crazy about seafood. Myself on the team and Jason and Shelley, we're all from the business development team supporting providers. So I know we've spoken to a lot of you in the last little while, and we work across different regions together. So I work with the key stakeholders across our Perth metro area and will be our moderator today and timekeeper. Jason works across the Perth Metro South, Midwest, Wheatbelt, Goldfields and Esperance region. So he's busy out there travelling the lands, as well as Shelley, who also looks at and working on the Peel region, Southwest region, the Great Southern, Pilbara and the Kimberley regions. Jason and Shelley are going to keep track of any conversations and questions that pop up in the meeting chat box. Housekeeping wise, with regards to the questions and comments from you guys on the floor, you can pop them into the chat for us to discuss later in the session, where we'll cross to those questions. Either write your questions in the chat box and we'll ask Roy Marder on your behalf, or if you'd like to ask Roy Marder a question directly, write that also in the chat box with your name and organisation, and time permitting, we'll invite you into the question time too. I'll now hand over to Roy Marder to take us through those curly COVID questions.
Welcome everybody. Thank you for joining us. Thank you for waiting on the technical difficulties just at the beginning there. You'll notice that I'll be turning to look at my left. I have my notes on a different screen. For some reason, I couldn't see them all on the same screen, but it doesn't matter. This next slide just includes all the links to the information, that we get all of our advice from and direction from as well. So please go ahead and access that. We'll be talking directly about these links, the catalogue, the arrangements and price limits, and also the addendum that was added on the 1st of March of this year. As you well know, we've had a few addendums since the last review on the 1st of July 2021. It is a lot to keep up with, but we do our best. We're going to go straight ahead. I'm a pretty casual presenter, and I would do the same thing if it was a face-to-face session. And I'd really like to just get stuck into the questions that were posed when you registered. So Dom, if you wouldn't mind, if we could just move straight on to the COVID general purchases. Thank you very much. So all purchases are dependent on the client's funding and needs. And what we mean by that is that we just need to make sure that the client has access to certain budgets. And that's because we can't, most plan managers, and this is all, interpreted our way. Each plan manager will interpret the guide in their own way because it's open to interpretation. So this is just the way we will do it. And you'll have to check with each individual plan manager on how they do it, because sometimes it can be a little different. So going ahead, what I mean by budgets is that, say for instance, if your client or our clients want to access PPE, we need to ensure that the client does have access to a consumables budget. They may very well have a core budget, but sometimes the service booking does not include consumables, and we do have to request access for that. And that could be different for different reasons, because they may be self-managing it, the agency may be managing it. So we just like to check, and we make sure that we check with you guys as well, the clients. So getting stuck in, the first question was, what COVID-related purchases can be purchased or reimbursed from a person's NDIS funding? So it's anything, going back to the bones of it, is really anything that relates to the disability or the plan goals. So say, for instance, all of the PPE that we've noted on the slides going forward, there's some that we've done additionally, which we'll go through later, but masks, gowns, gloves, and in certain circumstances, sanitizer. And that's, there is a fine line there with sanitizer, because the NDIS do see that as an everyday expense. But obviously, if the client is using it over and above an everyday use, then it can be considered. There is also reimbursements for RAT tests, so rapid antigen tests. We can only reimburse those, and they haven't put a limit, but they've kind of put a little number there for us to be guided by, which is $12.50 for each rapid antigen test. There is no limit at this stage of how many can be purchased. And going back to PPE, there again put not a limit, but a number there, which is $50 a week for PPE. The other thing is low cost AT, telehealth AT, which is most commonly, well, actually most plan managers will claim the funding for that from our 15 budget, improved daily living. They have put a limit on that for iPads, and that is $750. I understand that it is quite hard to find iPads under $750 at the moment. So we do ask that if the only one that is available for the client, that we seek some approval from the NDIS. And we're happy to take approval given over the phone. So if you're making a call as a support coordinator, say for instance, or even a client, when you call the NDIS, if you could just retain the receipt or reference of that call, we are happy to take that on and submit a claim that way. But we can't do it any other way for something that is excessive to the $750. And it may be a bit confusing because, we use consumables and they have a limit of $1,500. But if this purchase is related to telehealth, there is a limit put in place, which is that $750. And please, if there's something else that I'm missing here in regards to general purchases, please just pop it in the comment section. what cannot be purchased? That was the next question. Anything that is not related to the disability or plan goals of the client. Anything unlawful, so anything not legal, it's pretty much back to the bones of the funding, the intention of funding anyway. And anything that is an everyday expense. So for instance, a refrigerator, a full-size refrigerator, would not be considered an NDIS fundable purchase. So if a client was of course needing it for medication, it would have to suit the amount of medication that is being used. So a small, it's dependent on how much medication the client needs storage for. So if we are only having say 2 liters worth of medication, obviously we wouldn't be going out to provide payment for say a 500 liter refrigerator. And we have been asked to do those sorts of things, but it's things like that, or buying a car for a person that may need a new car to get places. Again, if there's something that I'm missing, please let me know. I will touch on, just quickly, anything that is funded or suitably funded by another department, say educational, like purely school, educational activities or courses. The NDIS will look at that as more suited to the Department of Education, of course. Next question was, what happens if a person has no more funding available in core or consumables? Well, that is straight to the NDIS for a review. So you'll be straight into a review request. Depending on the client, I think a call, I would recommend a call to your plan manager. They may have an idea of using other budgets in CB. Capacity building. So it depends, depending on the support that is, that they'd like to connect with, it might fit into that budget. So I'd say, like, 1, straight away request a review, and 2, check with your plan manager, or even just give the NDIS a call. When self-managed, what should you do to ensure your claim is approved? Again, it has to sit within your disability, the client's disability and plan goals. And it also has to be within the price limits. Sometimes, some people don't really realize when they're doing, say, for instance, a car detailing, and it's maybe $300 for the hour. We can't provide payment. No plan manager can provide payment over and above, say, the $49.30 an hour, or so forth, or 50, cleaning budget. I'm sorry about that. I'm just having a bit of an issue with yet another technical issue. I apologize for that. So going back to that, so yeah, it's sticking within the price limits for self-management. It is not as strict as plan management and NDIA managed purchases though. So again, I would still ring up and check with the NDIS, and then ensure that you have your invoices, letter of recommendations, or letter of supports. If it's for a reimbursement, please make sure that you provide a receipt, just the proof of payment. Okay, so next one. Can clients buy in bulk, and are there any limits? So I just briefly touched on that. At the moment, depending on the item that you do want to purchase, there are no limits for PPE, RAT tests, as I said earlier. But there is only a guideline limit there. So they're $12.50 for RAT tests and $50 a week for PPE. And why they say that is because some people may use over and above $50 worth. And with, what would be, I don't even want to say normal, but some people might have like a couple of boxes of gloves, a couple of boxes of masks, but then some people might need that on the daily. So it's looked at individually. It depends on the person's circumstances. What about freight, postage, and delivery costs? For NDSP, we will process payment for delivery, freight, whatever is involved in the invoice, because how else, we see it as how else are they going to get the item? No point in paying for an item and then having them to work out how to get it there. So that's not been an issue for us. We just process the payment. Yeah, we do, of course we'll pay the delivery. Interpreting RNN in the COVID related purchases space. So RNN, I guess, yes, you would consider reasonable and necessary. It's not really something that we go through the process of doing, because that's not our it's not our position. It's not our job to go through and see whether an item is reasonable and necessary. We do have to, we will ask questions just to relate it, so we can make sure that it's all fits within the plan, but we don't determine RNN. But I will say again that it should be, related to the disability and the client's plan goals, or your plan goals. And how we can assist in that is please just give us a call. If you have any questions, myself and our team in our WA office and the South Australian office, we're pretty clued up. And if they don't know that, if somebody doesn't know an answer, we ask each other, we talk to each other about it all the time. So anytime you have a question, just give us a call.
Next slide.
Yes, please. Sorry, Dom.
That's all right, Dom.
As usual, I tend to just talk myself silly, but and if you do, oh, there is a question with us. Okay, yeah. Any conditions, flexibility available? Okay, so this next question, do you know of any conditions or flexibility available for individuals in very remote communities? I guess the one that stands out the most is being able to use family members as support workers, because of the, I guess there's the lack of access to service providers in those areas. And we will also take approval from the NDIS by phone call or email, written. But in most cases, it's explainable. If you're living in a community of, say, 16 to 20 people, and your closest town is, I don't know, 100 kilometres plus away. Yeah, it just makes sense, and I'm glad that the NDIS still consider that a fundable support. Anything other than that, other than the differences in, I guess, price limits, there's nothing else that that has been provided extra. Yeah, so yeah, that's I had a look around and I couldn't find anything that was stand out for me to share. So, but the biggest one for me I thought was great was that the fact that you could use family members or friends to provide supports. Is there a guided process? This is the next question, sorry. Sorry, Dom. So meal preparation and delivery, I'll have a look. I'll talk about the slide since it's there. So they've actually, the NDIS have added that extra line item in 01 that doesn't require a quote, but they've also said in it that it must be included in your plan. So at the moment, we're going with the stance that we do have to have NDIS approval until they clarify that information. So on one hand, they've said it's not quite required, but then they're saying that it has to be in your plan. I do know that the guidance, clearly says that if support is being provided already, like say for instance, if you've got a support worker going out to do your shopping or assisting with you, taking you to do that shopping or helping you within the home, that you can access it. But then again, they've also put in that it has to be in the plan. So it's kind of contradicting. And for NDSP, we just want to clarify that information before we go ahead and say blanket, yes, you can just use the new line item. Again, we will take written approval from the NDIS or even a receipt or reference of a phone call. So NDIS states clients require core funding that would normally be used for support worker hours. Yep, that's exactly what was written in there along with the plan stuff. So supported independent living, They're continuing, so this was in the previous addendum with direct billing to the NDIA for SIL workers that have, for these extra supports. Unfortunately, they've removed it for every other support worker, and they haven't included any supports or funding for any other support workers. So we're assuming that they believe that the provider needs to get their own PPE and stuff like that in the meantime, if they're not working within the SIL space. So that information, the new information, or the new addendum stuff, or things that they're continuing on the addendum from pages 1 through to 10, and pages 11 through to 22 are all of the supports that are no longer current. So please just have a look through that and familiarise yourself with those. Okay, Dom, next slide, please. Okay, so this is us going back to the consumables and PPE. Purchase of PPE must relate to the client's plan, goals, and disability. Clients will need to discuss with the NDIS directly if funding may be consumed by PPE. And that, that's purely because we don't want the funding to, I guess they don't want the funding to run out for all the other support. So it's just ensuring that, buying one thing is not going to, stop the client from getting other stuff. I beg your pardon?
Yeah, they don't want to exhaust the budget, I think.
That's correct. Yeah. And just it's exhausting the budget, and then just, we just don't want like the critical care or necessary care, even though we know that it's all necessary. It's a fine balance between what's essential, I guess. So purchases must align with the NDIS price guide. So yep, and there's a lot of people that don't know what the price limits are and how they work, and that's completely understandable. I mean, the support catalogue is massive, and if you're not really familiar with the supports that are provided out there, it can be quite overwhelming. And I just recommend a phone call to our office, or and we can help clarify, which line item or what price for your area, as well as we know it all changes for standard, remote, very remote. So, just getting all that cleared up, so you're not waiting. Well, it just prevents delays with payment if we get it all cleared up before the invoice is submitted. Providing, we've gone over all of that. Yeah, next slide, please. Thank you. Again, I touched on this earlier in regards to telehealth services and the purchase of electronic device. I just wanted to just chat about laptops and phones, because that was as a purchase, because that was one of the questions that was posed. At the moment, we have our directive in the company is that we require a letter of recommendation or support for a laptop or phone. An iPad, that's pretty straightforward. The NDIS have no issue with that, but we just need more information as to why an iPad is not suitable, and why a laptop or phone has to be purchased in its place. And most times it's quite, it's explained quite well. Some people just an iPad may not be, I guess, big enough maybe, or a little bit the client may have an issue with being able to use that specific device. So, and then again with phones, same thing. So yeah, we just a letter of recommendation, or a letter of support for a laptop or phone. Next slide, please, Dom. Additional supports available. So a question was asked, like if the client or if you're running out of funding, well, what else, or you've run out of funding, what else is there available outside of NDIS funding? So we've just added a few links, and this one is for is this one? I just want to double check. So yeah, so this one has all the ILC links in there. Let me just pull that up. Seems to be a bit odd for me. And apologize if I'm so used to working with acronyms that I sometimes forget what they mean after a few years. But I just can't seem to open that up. But it just provides, this link is really good to go, to have a look in your local area for community-based community companies that are provided with, have different funding available to them to be able to provide sometimes free or, no, actually all the time, free courses, activities, sometimes supports. So you just have a squiz through that, depending on your client, it may be very helpful.
The other one, same with I think that's an extra link, isn't that second one?
Yeah, Department of. Yeah. That was just the Department of Communities link and what supports that they have available also. I'd also look at, there is another link, for some reason I could not pull it down this morning, and it was just on the NDIS, and that's in regards to health and safety, and I'm pretty sure you can just look under health and safety. And it has all the, it's a little bit more in depth in regards to the addendum, and it's also that's where I pull a lot of my information from as well. And for me, when Dom just introduced me, and I probably should have done this at the start, and I apologize, I talk too much. It's just one of my things. So I used to be an LAC, and I was an LAC for a couple of years. I rolled out with the NDIS here in WA in the Southeast Metro, and I was there for at Mission Australia, their head office. Loved it, but I just really wanted to get involved more hands-on with participants. And then I joined plan management. I've been in plan management for a year. So that's where I get all my experience from, but I know that there are so many people out there with so much more experience, and I just love to learn from everybody. I like to educate, and I like to be educated. So if there's some extra stuff that you guys could share with me, I'd love it. But yeah, let's get involved with, if there's nothing more that I need to answer in regards to the questions that were previously posed, but if I have missed anything, please add it to the chat. But Dom, was there anything else that come up while I was chatting away there?
I'm going to hand over to Jason and Shelley, and they'll take you through.
Great. Thanks, Dom. Thanks, Reimata. That was great. There's a couple of things that come up. A couple to start with was just clarifying some of the comments earlier. So one was from Vicky, and it was to do with the iPads, and she said, sorry, did you say that iPads come out of improved daily living?
That's correct. So when it's in regards to telehealth, it comes out of the low-cost AT, self-management, and improved daily living.
Perfect. Thank you. Jason, did you want to ask the next one?
Yeah, sure. Thanks, Shelley. Daniel's asked Reimata, does it make any difference if a person lives in a facility for some time? For example, if they're in an aged care facility while they're receiving therapy?
No, not that we've not been made aware of any difference to, just because they're in any kind of facility, or whether that be SIL, SDA, aged care. No, the only difference is if they were in hospital, because that would come under Department of Health.
Perfect. Thanks, Reimata. And Anna, who's up in Karratha, I think, has asked, sorry, were you saying that the NDIS would pay for informal supports as support workers in rural areas?
In remote or very remote areas, yes, they will consider it. If you are unable to access a provider for the support that is required and is essential, they will consider it, definitely. Because how else are they going to get supports? Good, amazing question. And I know I lived in Karratha for 8 years, and yeah, it is slim pickings up there. So I'd be having a discussion with your clients, LAC or planner if you can, or just a phone call to the NDIS and just having a chat about the circumstances.
Thanks, Reimata. We've also got a question from Stephanie just asking about deep clean. So can you get a deep clean if the participant tests positive for COVID?
Yes, they have added that. Depending on the area, there is a limit that the NDIS are willing to pay. That is also in the addendum. Let me just have another look. For SIL, of course, as mentioned earlier, there is a direct billing agreement in place, or arrangement in place, sorry. So all those invoices for payment would go directly to them. But let me just double check. The measures. Maybe it's on there. Yeah, I apologize. My computer is just not playing the game. But there is a and I can add that later on when it's just not playing. I'm sorry, but there is they do provide funding for that, the clients, depending on again what budget they have available to them, where we would be able to provide payment for, I think it's they consider it one deep clean per COVID, well, I guess positive case. So we're like, I would like to double check that though before I go ahead and add that on there. But as far as we're aware, we're paying for deep cleans with a price limit, again, depending on area.
Thanks, Roy. Yeah, I think some of the resources that we'll share post session will include these slides, and there is also an update that some slides from the NDIA. That's an update from the 4th of March that includes some information about that as well. There's a question here from Patricia. If a person's core supports are agency managed, are you aware if there any registered providers who can provide RAT tests? So if there are any, does that make sense?
So is this for the participant, being...
Patsy, did you want to unmute and ask that question yourself?
Yes, sorry, I'm doing this on my phone and I'm getting all fat-handed.
Sorry about that. It's fine. It's very casual here. We're casual.
Yeah.
I've got some participants whose the core supports are all agency managed, and most of them are plan managed, and we can claim the RAT tests for them and their support workers. But I'm just, the one thing we had was, well, what if they're agency managed? How can they go and get a RAT test? Because I only know of chemists really to get those items. I'm not aware of any providers unless there are.
Right. Okay, I understand now.
Sorry.
That's okay. That's a good question though, as that's not something that we've come up with, being in our space, who is a registered provider of rapid antigen tests. I can look into that for you, Patricia, but right now I can't answer that. I'll definitely have to make some queries.
Oh, no worries. I just thought in case you'd come across anything in your travels as you've been working, but if not, I'll search somewhere else as well. No worries. Thank you.
No worries. I mean, it might be I'm not sure, but you have Independence Australia, Daily Sports, places like that. Surgical House, they may very well have them on there, and they're definitely going to be agency registered.
Yeah,
okay, lovely, thank you.
I was just going to interject there, Reimata and everyone online, if there's anyone that's joined us as a provider that does have those in stock, drop us a line and let us know that you guys have stocked them, and we'll let everyone know. But I was definitely thinking along the lines of those Surgical House providers as well. I know they recently got a whole bunch of masks in, so I'll actually take that mask surge after this call and get back to everyone.
Oh, thank you.
I wonder if any of the major chemist lines are registered providers. I don't know the answer to that either. It is an interesting question. Yeah.
And just mention there, we don't have any other questions in the chat at this stage, but is anyone, we don't have access to Reimata this easily all the time, so feel free to ask any questions. As she said, she loves answering questions. So if there's anyone there, please put your hand up or unmute and ask them.
If you remember later on to just, give us a call at our office. What our number added to this? If you've got,
we definitely have our numbers.
Oh yeah, cool.
So anything further from the chat there? I can see 4 or 5, a few more coming in, guys. I'll cross over to you, Jason and Shelley.
Yeah, so a question has just come in from Rachel. So just clarifying, for participants in very remote communities, the process they have to go through to employ support workers directly, is it just ABN, police check, ...
For pay, so is that a plan managed or sorry, did you say agency managed?
Rachel, did you want to unmute and ask, give a bit more context for that question?
Yeah, sorry. Yeah, plan managed. So it's just that I have a participant in a very remote community, and of course there's no service providers out there. So he has a plan, but there's no one out there.
Yeah.
So just I've been trying to like think, how can I, like actually get help? And so yeah,
I would definitely start checking out whether he's registered for the free rapid antigen tests that are available, that are being sent out to all communities in WA. So they've got 15 going at the moment, started off with 5, but I definitely take advantage of that. Then at least he doesn't have to worry about it, for that much at the moment. And also with rapid antigen tests, we can only reimburse for those, and it's a consumables claim. So we, must ensure that they do have a consumables budget. But yeah, so it's if they can get it purchased and you can get an invoice and a proof of payment, reimbursement is the best way to, is the only way to go.
Yeah, cool. Thank you.
No worries.
And Roy Marta, I just have a further question from Diane, just asking, is there a specific line item to which a service provider would charge a participant for RATs?
Is there, so it's a consumables one, and it comes under the 03 budget, and the line item off the top of my head, I can't remember what it is, but it's low disability related health support, low cost. I can look at it after for you, but it's, I can't remember all the numbers.
Oh, come on, Roy Marta.
You're really testing me today.
There's only 15 of them or something, isn't there?
1,500.
I mean, in the one line.
Oh, yeah.
Thank you. So who is this? Linda. Thanks, Linda. So Linda's put in the chat there for everyone. Some Terry White pharmacies, Outback pharmacies and Super Pharmacy are NDIS registered. Chemist Warehouse have a method for agency managed participants to purchase. They can use a third party called My Autonomy. Okay, cool. Thank you for that, Linda. Did anyone else have any questions or want to unmute themselves and ask any more questions? We've still got 20 minutes, but I mean, it doesn't mean we all have to stay on, but yeah.
Yeah, don't be shy. Ppe reimbursements, here's another little one from Daniel. Daniel says, I'm sure you've covered this, sorry, but did you say Ppe reimbursements are just for customers with consumable budget too? So customers with core for daily living, etc., can't get PPE.
If they've got, we can always see if they've got, if they can access that budget. But yes, and for PPE, it doesn't have to be a reimbursement. I mean, we can process a payment for PPE. It's just the rapid antigen tests that are reimbursement only.
Great. All right, guys. Well, like Shelley said, we still have a little bit more time, so you're welcome to just unmute yourself and chat away. I'm just going to see that last one chat, guys. No, that's it. He says thanks. Good. All right. Otherwise, I'm going to just. Oops. Where's the next slide? Sorry, now my screen's frozen up a bit. I'm just going to say, if anyone wanted to get in touch with us, our contact details are here. And my last little slide will say, thanks for joining us, and we hope it has been really helpful, and we look forward to bringing you some more sessions in the future. So after this, we will send you via email the presentation for your reference, and it's also on, this recording will be on our YouTube channel, as I mentioned, but also pop down any future sessions that you guys are keen to hear about, as we'd love to bring something further to you in future sessions that you're really keen on hearing, whether it be home modifications or, you know, some more AT stuff. Just let us know and we'll do our best to put something together, or invite someone to come and have a chat with us. But again, thanks for joining. Thank you very much, Reimata, for all your intel, and thanks everyone for dialing in. We'll see you next time.